I'm Dr. Mahesh Gowda. I'm a psychiatrist. I work at Spandana Nursing Home and Spandana Healthcare, Bangalore. Spandana is an exclusive psychiatric division. Here, major psychiatric disorders, minor psychiatric disorders, addiction, counseling, and psychotherapy is being attended to. Earlier, if I were to put you back in the other way, people would hesitate to seek consultation for even minor or even major problems. Now, even the smallest of the problem, they are willing to take help because nobody wants to suffer pain. Everybody wants a pain-free life. So, small things like sleep, anxiety, depression, or interpersonal conflicts with husband and wife, family discords, addictions, major psychiatric illnesses, host list of them, all of them are ready to come and consult us now. All of us are at some point or the other on a stress module. So if it is positive, we call this eustress. If it actually becomes painful, if it interferes with your work, education, or relationship, yes, it becomes a distress, and that's why it's called a negative stress phenomenon. In case he's unable to handle a conflict, this conflict will come in way of his functioning. It could be reading, it could be working, or a relationship. So when there's an interference in his normal routines and functioning, that's when he needs help. Otherwise, most of us go through stress. Does not mean everybody has to consult us. When he recognizes he's unable to handle, he needs to take help in family or a friend level. If that's not working, they need a professional help. All of us have expectations of what we want to do and what we plan or intend to do. When we have certain resources which are enough to handle all these ambitions and desires, there's always a peace at mind. When we are not able to have the required resources or the potential or the required energy to sort out all the ambitions and difficulties that we have, there's a differences in the potential and the actual desired responses. So that's when you get into a stress phenomenon. You must try all the non-medical interventions. It could be a simple thing like relaxation, it could be physical activity, yoga, meditation, a simple thing like gardening. Horticulture is definitely a new form of therapy that they use, music. So all these are non-pharmacological means of intervention that help people to fight stress, also fight the depressive and low moods. Once you actually tried all those things, it's not helping, I think you must seek medical help. If you were to look at life 30 years earlier or 40 years earlier, our lives was much more simple. We didn't have any of the gadgets. You knew when you would get up, you would know when you would go back home, and your routine was very simplified. Now it's very demanding. 24 hours doesn't seem to be enough at all, and you don't have time to sleep. Earlier, there's a very nice compartmentalization where you had 8 hours of work, 8 hours of family time, and you would have 8 hours of sleep. Now the whole thing seems to be messed up. Everything seems to be demanding, and the most important thing that you compromise on is family time. And if family time is all compromised, you have nothing else left, then you compromise on your sleep time. So everything is being used for work. So that's why there's a lot of change, and we're all driven to perform more than what we actually can do. If we have a potential to perform X, we are all performing at 3x, 4x speeds. So definitely there's a lot of stress on the body. We all have resources to handle our difficulties. So we keep trying, and when we keep trying, we get some amount of recovery process that keeps happening. And once we reach a stage when we keep trying and it's not actually giving the required benefits, then you actually start looking at what is happening with you. The stress becomes too much to handle, and they actually feel helpless. If somebody gets help with the surrounding, it could be family or friends, somebody can actually bring about a change in this difficulty. If people don't get help at those times, that's when actually they get into breakdown. Breakdown can be simple thing like a lot of anxiety, when they can have panic attacks, when they can have phobias and avoidance phenomena to a situation. Or it can be depression, when they actually lose out on the intentions, they lose out on the energy, they become sad throughout the day, they become helpless, they become hopeless, they think that life is not what they think about, life is not worth living. Sometimes they also contemplate death as an option. They make suicidal attempts. That's when they become severely depressed. Or they can also go into a phenomenon called a major psychotic breakdown. Here, the person loses touch with actually what's happening in the surrounding. He fails to recognize what's real and unreal. So he starts imagining things. It could be fear, It could be a false fixed belief of somebody trying to harm him, or somebody trying to do some black magic on him, or somebody actually trying to do something negative against his family. So he has this persistent belief of something actually going wrong. In spite of giving evidence to contrary, in spite of the family not sharing these sort of belief systems, he continues to believe this phenomena. So we call this a false fixed belief, and that's when we call them deluded. At least on 100 cases that we see in a day, we have at least 5 to 6 cases who come to us with psychotic breakdown. These are all fresh cases and not the old follow-up cases. So at least 5 to 6 patients do present to us. We are a tertiary care psychiatrist setup, but I'm sure a lot of other setups also seeing similar cases and presentations, but the ratio could be different. But here at least 5 to 6 every day is something new that we see with this sort of indication. People with depression also have this sort of unrealistic expectations and experiences, but a person with schizophrenia has predominantly these sort of symptoms. It could be a delusion where he has a false fixed belief not shared by the family and which cannot be corrected by any amount of deliberation or counseling, or you can have unrealistic perceptions. It could be hallucinations, he could be hearing things, or he could be seeing things. This is called schizophrenia. It's not very difficult to treat them if they accept the medical model of an illness like that. The moment somebody comes with these sort of experiences, we have to do a detailed evaluation and see whether this happened on a background of a fever or a head injury or anything connected to the neurological system. If it's not connected to the neurological system, it's everything to do with the mind. So if it's everything to do with the mind, just giving a medical model of how it works, how there's neurochemical disturbances, and how actually medicines can be beneficial is something that the patient must accept. If he is able to accept, I think the recovery is possible in 2 to 3 weeks time. If somebody believes that they have supernatural power, it's a very wonderful feeling. Nobody wants to accept it, but you believe in supernatural power, so you feel supreme. Why would you want to give it up? But if this sort of belief is coming in his functioning, or in terms of his relationship at home, or it's actually brought about conflict with the legal system or a law enforcing agency, this sort of beliefs cannot be harbored forever. Yes, it needs to be treated, maybe at times against his will. We call this poor insight, and the law provides for treating such people against their wish. Yes, what the law says is you take the consent of the family, and 2 psychiatrists certify there's a need for treatment, and there's something called Section 19 in the Mental Health Act, which allows you to keep him in the hospital against his wish and treat him for 90 days. If you want subsequent extension, you can extend it based on the requirement for such an extension. Yes, you have these sort of rare presentations where people want certification. They want somebody to be labeled as sick so that this can be a ground for divorce in the court of law. But the law is also very clear now. The judges have been sensitized. Mere presence of psychiatric illness is not a ground for divorce anymore. So there has to be illness. It has to be dysfunctional enough that he or she cannot function her role or his role as a family member, cannot have procreation, is not able to function as a mom or a dad, is not able to make to his day-to-day activities, and cannot work. If there's a dysfunction and he cannot function in his roles and responsibilities, that's when the court will actually think of a divorce here. Otherwise, mere presence of a psychiatric illness is not ground for divorce. Yes, when they come for this sort of certification, we're very, very sensitive. If they come for treatment, we are all comfortable. The moment they ask for certification, we all have our antennas up. We look for why is that they want certification, and we are very careful, and we don't issue certification to the spouse, because it's a confidentiality issues. If the patient or the client who's considered us wants for a treatment certificate, anything like that, we take it in writing, take the signature to say that they've actually received the copy, and we give it to the client. We don't give it to the spouse, because it's breach of confidentiality here. Yes, there's a definitive correlation between a psychotic breakdown and substance use. It could be any form of substance use like marijuana, cannabis, alcohol, opioids, or medications and prescription drugs that can be abused. Too much of use can actually lead to a breakdown, and these are the cases that is almost difficult to treat, because they continue to abuse drugs, they continue to have breakdown, and in this breakdown, suicide can be a major threat for them. If you look at the incidence of bipolar disorder, it's 1 to 2% is what they say. And when you say a person has bipolar disorder, he has two phases of mood. One phase of mood which is depressed, which we all explained and discussed about. He has no energy to do anything, he is low in mood, and he has absolutely no motivation to do anything else. Just the reverse of it, he could compensate by being actually over enthusiastic, full of energy, feeling cheerful or feeling irritable, not feeling the need to sleep at all, having trouble concentrating or doing any work. He can be reckless, he can do a lot of things in a quick time, and he has impairment in his judgment. So this is just the opposite of depression. When people have this sort of cluster of symptoms, being hyper or being low in mood at different points of their lifetime, they could be suffering from bipolar disorders. If you look at anybody who's been subjected to trauma or being a victim of a sexual abuse or a rape, the first important emotion that they go through is being helpless. See, what happens that time is psychological trauma, physical trauma, depression, all those things can happen, but most importantly at that point of time they feel helpless. Had they had a lot of help and did they have any sort of vent for whatever happens that time, they would have been protected. They could think and ask about themselves, why me, why was I the chosen one, why should I go through all these things, and what if there was somebody at home who could help me out, what if there was a protective person, what if this person did not have the access to me. So there's so many questions that comes to the person's mind, and helplessness is something predominant. They go through a lot of guilt. They think that sometimes they were the one who were responsible for the whole event. They tend to blame themselves. When they feel a lot more guilty, they get depressed. And it can also take a turn of having major psychiatric disturbance like psychosis, or having simple things like panic attacks, insomnia. It basically depends on how much help that she gets or he gets at that point of time. Panic attack is something that you have intense emotional disturbances, where you have a lot of symptoms that happen in your body simultaneously. It could be simple thing like sweating, you have a racing heart, you have butterflies in the stomach sort of sensation, you feel extremely restless, you can't sit in one place, and you actually think that life is going to come to an end. The heart beats so fast that you actually think it's going to stop at some point of time. You feel that life may not exist at the end of this attack. So this is something that's described as an intense fear or intense attack of panic. Phobia is there is an event that triggers this sort of anxiety and panic response. When you tend to avoid this sort of situation, you are described to be phobic. So the emotion here is fear and anxiety, so that's one part of the panic. When you avoid this sort of situation that generates this panic is a phobia. 5 to 6 hours of sleep, if you can feel refreshed without having too many breaks in between, I would call this as a good sleep. It could be variable. Some people sleep up to 8 hours, some people sleep 4 hours, but when he gets up, he should feel refreshed. So if the refreshing feeling is not there, I think there's some problem with the sleep architecture. You need to address this issue. When you say he's a psychiatrist, he has to go through a 5.5 years program of a rigorous medical training in a medical school. He does 1 year of internship, which is an exposure to actual clinical population. Then he does a 2 or a 3 year program in psychiatric training. So it's a specialty after your medical completion of MBBS. If you say you're a psychologist, you could be a person with an arts degree, you could have done your MA and BA, then go on to do an MPhil, and then you would be called a psychologist. Basically, these are clinical psychologists. You can visit any one of them. Any one of them, something that's mild and moderate will be handled with counseling, discussions and therapy. So psychologists will be good enough and they can take care of it. Something that cannot be handled with just counseling, they are quick to recognize and they would refer them to a psychiatrist. So even if you come to a psychiatrist and I get to see them, ours is a team approach. I can't do everything on my own. I will definitely take a help of all these social workers, case managers and psychologists to make sure it's a combined multidisciplinary team approach. You need everybody to manage this sort of problems. Yes, whenever there's a trouble which you are unable to fix, don't always hesitate to share with people. It could be your near and dear ones, it could be people whom you can associate with or whom you can share one-to-one, it could be a friend. If you can't find any sort of help around, please make sure you discuss with any possible professional counselor or a therapist who can actually be the first level of contact. Some people are religiously minded, so actually having immense faith in religion and actually praying to God itself can be a lot of solace to people. And when nothing can change with this sort of intervention, please always look at a psychiatrist's help or somebody who can give you a medical mode of treatment for you. If they have not actually found help, it's basically they have not decided to take help. If you want help and if you go to people, they can generate 3 or 4 options for them. If one option does not work, you must be able to look at other options. If none of the options are working, you have decided not to get better because you're not flexible. You're not able to adapt to any changes that have been suggested. There are a set of clients who come to you with a problem. They have a fixed solution for it. They're not ready to look at alternatives, and they want a solution that is acceptable to them only. For example, I suggest something that I don't think is right in my own understanding. I may be wrong, but I'm saying this has not worked in your case, so why don't you try something else? He's not able to adapt and change the other thing. So people who have a closed mindset, who have decided not to change their views and alternatives, are the people who don't do well. Actually, if you were to go and talk to somebody who's a stranger, who's a professional, and you're going to talk about intimate, deep secrets in him, first thing is that you must have the confidence to talk to them. In the initial phases itself, the therapist or the doctor who's seeing you establishes rapport. You can connect to them. If you fail to connect to them, I think you cannot reveal the details of confidential issues with them, and it becomes an unsuccessful therapy. With all the sessions that you spent, if you cannot connect, you must change your therapist. There must be something wrong in the way that you are interacting with him, or the way he's understanding and picking up the clues in your discussion. Only when the rapport is established and you have a one-to-one understanding of confidentiality, and what you discuss is going to be extremely confidential and documented only for the purpose of discussion, not going to be shared without your consent, then you must actually open up your actual difficulties there. It's a very unconscious process. We call this issue of transference. When you see a person for the first time, there's some amount of appeal that happens to you. You start liking the person as such. It may not be a physical like as such, you can emotionally connect. So we call this phenomenon transference. When you actually have a liking for the therapist, that is a very healing process. It's very important for a successful therapy. If you don't have this sort of positive emotions towards the therapist, you must discontinue. Somehow for long time, somehow psychiatry has been a very shunned away subject. For them, psychiatry means somebody who's conked, somebody who's disheveled, roaming on the road is only somebody who needs psychiatric help. That's the older thinking. Now anybody who has a problem with their understanding, have a problem in resolution of the crisis or symptoms, are the people who just want to come and discuss the problem. It could be simple thing like academic counseling, it could be a career guidance, it could be a relationship issue and discussion. All these things are not major problems, but there is definitely help available as far as psychiatric services are concerned. You must not hesitate to take help. If you've taken help at family level, good. If it's helped, excellent. If it's not helped, please look for professional help. Yes, there's a lot of change in simple incidents itself. What was 10% has tripled now. It could be addiction. Addiction is definitely a major issue. Problem with both the sexes and the type of addiction. Earlier, people with alcohol are the people who seek help. Now, cannabis has become a big killer for adolescents. Opioids. A lot of these addictions are taking away the energy and the motivation of youth. They are all becoming dysfunctional. And if you look at all major illnesses, psychiatry deals with schizophrenia, bipolar, depression, or any other major psychosis. All these are definitely increasing. So because there's so much of demand on performance, there's a lot of anxiety associated with performance, and these are the people again who come for help. And if you look at the current market trend, everything seems to be doubling, and if you look at inflation, definitely this is on the inflation side, and there's definitely a lot of work for psychiatrists and mental professionals. Children are the one who are the most troubled lot right now, be it a kindergarten child or being an adolescent or somebody in college. Somehow I feel there's a lack of role models, the lack of parental time with a lot of quality time that's spent with the kids. Most of the time is spent in colleges, schools, tuitions. They hardly get any time for parental interaction. Simple 10-15 minutes talk with the parents, briefing them on what happened every day is something very vital. Having a common dinner or lunch or breakfast is very vital again. When these things are not there, the child feels very alienated. Most of the kids are managed by maids. Sometimes they're lucky they have grandparents, and they're doubly lucky they have parents managing them. So this is the sort of change that is happening, and definitely kids are very vulnerable. Too much of academic schedules and lack of play, lack of recreation is definitely a big trouble for kids. Yes, there's definitive gender difference between men and women in terms of any psychiatric illness that you choose. If you look at major psychiatric illness like schizophrenia or psychosis, the men seem to have more than the women. And if you look at bipolar disorders, the men seem to have more than women again. But if you look at only depression, women seem to have more than the men here. This is one area where women compete better than men and get a fair score here. It could be anything, simple thing. I would always start my discussion with problem of sleep. Time taking sleep, time maintaining sleep, and time getting up too early from sleep is something that you must watch for. These are a very common problem which actually has major impact on our health. It could be a simple thing like heart attacks. If you don't sleep well, you're more prone for heart attacks. You can have a more chance for hypertension and diabetes. So simple thing like sleep could be fixed. Anxiety, phobias, depression, substance abuse, relationship problems. You can have a host list of problems. Problem with communication. There are a lot of kids who come to us with problem with learning, attention problems, mental retardation. So anything and everything where there's actually no medical explanation can be a reason to consult us. We call this somatization disorders. They have a lot of symptoms, body aches here, there, no relief with any of the medications. All investigation turn out to be normal. So these are still people with psychological distress and they would need a psychiatric evaluation.